guys for being here and being willing to talk about this. It's really, really helpful for people to hear from somebody that's gone through it, or somebody that has a child, or a spouse that's gone through it. So just to kind of get started here, your son Khalid was diagnosed with Crohn's how long ago?
I think it was January 2022 when he was officially diagnosed.
Do you remember some of his earlier symptoms? Like what did he say that got you guys started down that rabbit hole of going to the doctors and looking into what was going on?
Yeah, I mean, he called his mom from the school, and this was the first time we knew about Khalid's condition. And he was like, I need you to come and pick me up because I can see some blood in my stool. And it all started from there. No previous symptoms, no indicators. He was fine until that.
And he was around 12 at the time?
11.
11. Yeah, and that's got to be scary, seeing blood, not sure what's going on. And I have a 10 and a 12-year-old, so as a parent, I think you feel like you're more scared than the child, right?
Yeah.
True. So he had blood in the stool. Did he have any other abdominal pain or anything else like that?
Initially, I think it was only the blood and it kind of progressed with time. So it was formed and semi-formed and liquidy diarrhea. And then we took him basically to the doctor, and they did all the initial protocols, testing, and we thought it's a bacterial infection, so they gave him antibiotics.
Were they thinking it was SIBO?
Something like, yeah.
Okay. So they tried the antibiotics. Any help with that?
No. They actually made it worse.
Worse with vomiting. He at this point, he used to vomit.
Oh wow!
And at this stage, we're talking around 5 to 6 times bowel movement a day.
Okay, yeah, and so now he's having blood in the stool. It's pretty constantly diarrhea. It's loose. He's vomiting. The treatment isn't working. What'd you guys do next?
And then it all basically started from there. Literally the year of 2022, he spent literally more than 95% of the year at the hospital. He would just go to the hospital with, at the peak, he was actually going to the toilet almost every hour or every hour and a half.
Oh,
so
wow.
You're talking 25 times a day. He reached to the point where he was malnourished,
Very
underweight, severely malnourished. And then we had to go back home to Sydney. We took him to Sydney Children's Hospital. And that's when the new medication actually started working, which is Stelara.
Okay, because he was on Humira before that, was that right? Or
he started actually with Remicade.
Okay.
He started with Remicade and then to the next biologic, but he was always responding initially and then loses response
Right.
In a very short period of time.
And I think I've met a lot of people with that same response, where initially it feels like it's working, but then within a few months it's really not, or it's not working enough to be worth the hassle of taking the medication. And the side effects that can come from taking the medication.
Yeah.
So he finally got on Stelara after, it sounds like, about a year and a half worth of symptoms, something like that. And then the Stelara was helping. What was the change?
Stelara was helping until October last year.
Okay.
He started experiencing symptoms again, most likely like a flare-up. And that's when we were actually thinking seriously, along with his doctor, to start changing the medication, because we thought it's just another episode of him losing
It's another
response.
failure for another medication, another biologics.
And Stelara was his third biologic?
Yeah.
So they were planning at this point to put him on a new biologic?
Correct.
Okay. And I don't think you guys ever did that, correct?
No, we haven't. We came across one of your videos, and I remember talking to Zainab, and Cool. Let's try the 30-minute complimentary chat and then see what we have here.
Yeah, and maybe this is a good question. I like to ask for a lot of the listeners out there. Like, what made you guys? You're in Abu Dhabi right now, right?
Yeah.
What made you guys come across some stranger's video, and think like, hey, our son is having a lot of GI issues. I'm out there saying that the spine can cause a lot of these GI issues, and it doesn't get looked at, it doesn't get evaluated, and it doesn't get treated. What made you think that this would work? What made you trust that information?
To be honest, we're in a position where we would trust initially anyone that claims that can actually solve the problem.
Sure.
Because we don't want to be in a position later on to say we could have done something and we didn't. But when we had this complimentary chat with you, everything you said made a lot of sense. And we were actually positive about it even before trying it.
We had that gut feeling, a good positive gut feeling.
Well, I'm very glad that you did. And kind of fast forwarding a little bit, we'll talk about some more of Khalid's symptoms and stuff like that. But right now, we're 3 months into working together. We've done 6 sessions, all over telehealth. How's Khalid doing?
Too good to be true, to be honest.
As simple as that. Yes.
Yeah. He's going once a day, twice maybe sometimes, like literally normal. His energy is up, his weight is up, his mood is up.
Blood work numbers is very positive, very assuring.
You said because he had it recently, and it was the first time he didn't have any inflammatory markers other than his iron was a little low, right?
Exactly, yeah.
But that was the first time. And when was the last time he had a normal blood panel?
When he first recovered after this, the introduction for Stellara, that in the initial
I would say maybe remission.
Yeah, that's where his blood work were as positive as this one, and after that in decline until after working with you.
Thank you for watching the Spinal Truth Show. I hope you're finding this information helpful. If you're out there and you're still in pain and you're looking for relief, we have some solutions for you. You can schedule a consult with me or a session, but if that's not in the budget, we also have some options that are self-guided at home. You can go to thespinaltruth.com. We have courses set up right now for arm pain as well as for neck pain. They are geared towards you. They are a 4-week course, 60 videos that are self-guided by an expert in the field that you can do from the comfort of your own home at your leisure. They will take you through step by step the typical approach that I take with patients. The expectation is that they will provide significant relief over these 4 weeks. So if you're looking for something better, something different because you're not finding the relief, go to thespinaltruth.com, sign up for one of these courses, and get the right treatment, see the difference. Well, and so for the people listening, they're gonna wanna know what his symptoms were. And I have it here, what we wrote down on the first visit. He would wake up every 3 to 4 nights to have a bowel movement, which, talking isn't normal. You shouldn't wake up to have a bowel movement. In the morning, he'd have to go to the toilet very quickly. It was always watery, partially formed. There was blood most of the time. He had some musculoskeletal symptoms too, which we've realized that, if you are having a back problem that's causing your GI symptoms, there's normally some other signs. A lot of patients get either back pain or specifically pain or symptoms in the legs, and Khalid was having a lot of fatigue, specifically into the legs. He couldn't play soccer or, for you guys, football. Yeah. I'm trying to speak for the American listeners too. So he couldn't play soccer for more than 10 minutes, standing and walking for more than 10, 15 minutes. He would just become fatigued, he said. And I remember the first session that we had together, he looked, he was very thin and he looked tired. And let's see. So energy levels were low. Oh, food tolerance. He wasn't able to eat pizza, ice cream. I know mom's spicy cooking is what he said he couldn't eat. And those were the majority of his symptoms the first time we met. How are those symptoms currently?
Well, I can tell you for the first time in a very long time, he had the pizza.
And another one again.
Actually, he had it twice, yeah.
Since even after our last meeting, again.
Any problems with it? Any issues? And I think he said didn't he have pizza and ice cream in a day?
Yes, in
for
one
him
day.
it's too many. Those like we can call them processed food at once. This is a lot for him.
Sure.
Yeah.
And how did he tolerate it?
Very well.
Just normal.
Normal.
Nice. And the weight gain, and we talk about this, and people are going to want to know, how does this work anatomically? How's this a medical rationale? And we talk about how if the nerve signals that come out of the spine aren't getting to the intestines, which are smooth muscle, need to contract. They contract to move waste, pump blood flow through the area. That's how they heal. Moving waste is their job. If that waste sits there, you can get a bacterial infection. You're probably not getting as much nutrient absorption, especially if that waste is just not getting processed as well. So it can kind of make sense why this could cause inflammation, why this could cause diarrhea, why this could cause fatigue or all these other symptoms. And once he started processing his food normally, I mean, his weight shot up in the 3 months we've been working together. I think is he up 5 kilograms?
Around 6.
Yeah. Around 6.
The other day we saw endocrinologist, and it was 10 kg.
Wow. Oh yeah, that's right.
kg.
Yeah.
Wow. I mean, and in 3 months.
We visited her, yes, it was
Yeah.
10 kg.
And he's still a thin guy.
Yeah,
He's.
he has in general, he has a slim physique. It's a thin physique in general. Even when he was little, but he's much. He gained. There's some the weight. So yeah, we definitely. It's a big gain.
No, it's honestly, it's really great. And now talking with him too, he just seems more alert, more energetic, and so you're looking at this and you're thinking, well, why isn't this more well known? Why aren't more people doing this? And maybe to answer that question along the way, you guys have been dealing with this for 4 years now.
Yeah.
Along the way, did anybody say, hey, this could be a problem from the spine?
No, to be honest, no. We both read a lot of literature, a lot of, we saw a lot of documentaries. We knew deep inside that the vagal nerve and the nerve system is somehow playing a key role, but we didn't know how to actually address it. And, we were doing all these sort of, tapping, breathing, and, yeah, but no, to answer your question, no.
Nobody.
We never expected
Because
it.
no professional guidance. We did it initially, and we had this sort of information, but we didn't have professional guidance. And then we just dropped the idea until we saw your video.
And I think you guys said you took him to a specialist in Australia as well. Is that correct? So you had him seen in Abu Dhabi and you had him seen in Australia. You've been to multiple doctors over the years for this in different countries.
Yes.
Yeah.
Yeah, and it's frustrating for me too because again it doesn't necessarily make sense on a purely straightforward basis why the spine would affect the GI, understanding anatomy, but you need to have that understanding, that education. But now knowing what I know, all I want to see is that this just be an early part of the process. You take your son and he says, I'm having some GI symptoms, and they also look at his back. And I think that would save a lot of people a lot of time, energy, and hassle. I mean, you guys dealt with this for 4 years and it was mostly not getting better.
Yeah. Yeah, and it's whether here, whether it's in Australia, whether we talk to a lot of other doctors also elsewhere, like in France, and
Yes, true.
It's the same school of thought, the same protocol, the same, yeah.
Even when you tell them that you have these thoughts, or we met Dr. Caleb, or we came across Dr. Slater, and they would say, they would be skeptical.
Sure.
because some people, they do, even us initially, we were in full trust in the medical institution. You know that what I mean? But then we knew that there's more than just medications, injections. It's not the solution. There's something, our body itself, it's a healer. So there's the secret, and the medication is inside our body. And this is what made sense when we saw your video.
No, and I'm glad it did. And again, thank you guys for being here and being willing to talk about this, because hopefully people out there, I've treated a good amount of kids around, Khalid's age, and I'm seeing it more and more prevalent. And I think it's because we're just sedentary, like you look at how much, I think you guys said that really the only thing that he does was play video games, at the beginning. And part of it was, he wasn't feeling well, so he just needed something to do. But for a lot of kids out there, they're sitting in school, they're sitting at home, they're on their tablet or their iPad or their iPhone, they're looking down, and they're not moving their spine, and they're getting some problems from this sedentary posture. So the point is, I'm seeing it more prevalent, and you guys telling your story about what you went through and what you saw, hopefully that helps other people. When we talked about his initial symptoms, and the first thing was kind of blood in the stool, and then diarrhea. Did he have any other muscle issues around that time, or any joint issues? Was there anything else like that at the beginning that you can remember?
Yeah.
The swollen knees usually, and as you know, also the heel, the ankle heel, which is in general the whole legs. Also, he used to have a lot of headaches.
Okay.
Yeah, that was really very common. And those are basically, beside his gut symptoms, this is also headaches and the pain in the feet and the legs.
For a lot of these patients that have GI symptoms that are coming from the spine, I see so many of them have legs, a problem into the legs, hips, thighs, knees, but specifically the feet. So I think for people at home listening to this, that's something else to look out for. Look, if you're having GI symptoms and you're also having symptoms down your leg, hey, maybe think it's your spine.
Yeah, and in addition to what Zainab said, at the peak, he had stomach ache. He would wake up constantly. He would go 3 to 4 times overnight to the toilet. It was really, really bad.
Interrupted sleep is really bad.
Yeah, I mean, not sleeping, not feeling well, not being able to eat food, not being able to feel good after eating food. Even on his restricted diet, going to the hospital. I mean, for a year, that's pretty disruptive to everybody's life, your life as well as his. We started working together 3 months ago. And we've been doing it for the first few weeks. We did about a visit once a week. How long did it take for you guys to see any change?
Almost immediately, like literally.
We didn't believe it. The second morning, I check. I may sound a little bit gross, but I check his stool every time he goes to the toilet.
I mean,
I need to monitor what's going on.
Yeah, for what you guys have been through, it absolutely makes sense.
We saw you the day. The second morning, that night, no stool at night. He slept all night through. The first bowel movement, which is typical, normally in the morning at 8, and it was formed.
Wow.
Yeah, and I remember.
As simple as that.
I remember you calling me. I was at work, and she was like, "Hey, this is," and to be honest with you, I was like, maybe.
Maybe
it could,
sure.
We don't know.
Sure.
Let's keep an eye on it. And
since then,
it was just perfect.
And it's not all, for the people listening. It's not always like that. But when it is, it's great. I normally expect that within about 2 to 3 weeks. So however, the younger population, they respond a lot better, than your 45-year-old that's had this for 20 some years. Hey, just a quick break here and then we'll get back to the show. If you're out there and you want to see if this is the right approach for you, you can schedule a consult or a session with me. Go to thespinaltruth.com. At least set up a consult. Within 30 minutes, I will listen to your symptoms. I will go over your history. I'll go over what the approach I would take for you and the results that I would expect. My goal is to save you from continued pain, failed treatments, and prevent you from getting surgery. So go to thespinaltruth.com, set up a consult, and let me go over your symptoms. Now let's get back to the show. And looking back on my notes, by the second visit, so a week later, you guys were saying he was somewhere around like 60% better. You talked about the bowel movement. It was the first time it was formed in a long time. He wasn't rushing to the toilet. And then the weird thing is that there was like minimal to no blood in the stool.
Yes, true.
And for a while, there being a good amount of blood in the stool. And if you start to think about it, why would a nerve cause that? But, again, you go back to the intestines not functioning properly and how it could lead to inflammation, that makes sense. But it's pretty cool to see. And then even cooler to see on the biomarkers, the blood tests that he's having. That's another piece that you want to see in order to say, hey, this is having an effect. Because to your point, I think a good amount of skepticism is healthy for any type of newer treatment.
Yeah, but then the other cool thing we started noticing, which is really amazing, is for a very long time we've never seen Khalid, humming or singing or in a good mood.
Good mood, yes.
He's actually, he wakes up now smiling, in a good mood, humming.
Talks with us.
It was never the case for the last 4 years, never.
By the way, yesterday it was his first time since he got sick. He went
to go out with his
friends. Usually he goes out maybe with us, but to have the trust and the confidence to go out with his friends on his own, that was yesterday the first time as well.
Oh, that's great. That really is. People don't realize how much these GI symptoms can affect your social life, and that affects your mood and your general well-being. You're afraid to go out. You don't want to have an accident. You need to be by a toilet. You don't know how you're going to respond to different food. And I think you mentioned too, you guys took him to was it a water park recently or?
Theme parks,
a theme park.
Yeah, theme parks. Yeah, also we
like
went
an arcade kind of.
Also, we went swimming again since he got sick.
Okay.
It was his first summer also going swimming. A lot of things,
Amazing.
karting, a lot of physical activities that he wouldn't do before he started.
We used to whenever we wanted to go out previously, it was like we had to do like a planning, where are the toilets, are they clean, are they not clean, how many, even before entering the place.
Sure.
And it's no longer the situation now.
And I mean, that's great. Honestly, it's worth all the hassle that I go through from people online to hear stuff like that. Because there is a good amount of pushback still, and I expect it to be for a while. But hearing from people that have gone through it and how it's affected them in a positive way, that definitely helps cushion the blow a little bit.
Yes,
100%.
I've given Khalid a few exercises to do, movements to move the spine, to strengthen the spine. How has it been getting them in? How long does it take him each day? How has it been keeping him on this routine? Like, is it difficult? Can you speak to that a little bit?
Yeah, no, not at all. It's very easy. Initially, we started with the lowest weight, 5 kg. It was very hard for him even to carry those 5 kg. But still, he was consistent and persistent. He wanted to do the exercises, and we start in the morning. It takes us around 5 minutes, and throughout the day, 1 or 2 times, just single reps. And before dinner or bedtime, we do another set, the same
The morning.
The one in the morning.
Okay, which is great.
And gradually, according to your guidance, we started
Increasing the
weight, and now he's able to do 11 kg at ease, very
Nice.
Very comfortably.
Very comfortably. Yeah.
I remember watching him the first time, him doing the movement, and it wasn't pretty. It was, and I think he was tired after 3 of them.
Yeah, he was struggling a lot.
Yeah, and good for him for taking some of the onus and being willing to do this, because not every 15-year-old would be. But it's nice to hear that it wasn't hours each day. It sounds like it was maybe around 20-25 minutes of total stuff a day, which is kind of what I shoot for. I try to make it reasonable, because you have a busy life. He hopefully has a busy life. So it's nice to hear that it wasn't a lot. And I think we've kind of settled. He really has 3 movements to do. Is that right?
Yeah,
I think 3 total. Which if you're listening to this and you're thinking, hey, like 3 movements that if I do them for a few weeks, I might see a change. And if I do see a change, that might show me that the underlying cause was my back. I think it's worth it for pretty much anybody that has these symptoms to try that for a few weeks,
Yeah.
Absolutely. I actually, if there is one thing I really wanted to say out loud is, I think Khaled was so traumatized to the point that he was actually open to try anything, literally anything, that will make him avoid the suffering and the pain and to all those out there, just give it a shot.
Yes.
Try. You won't really lose anything
At all. Yeah.
No, it's been great watching him go through that change. It really has. He put on about 20 pounds, in 3 months. That's huge. And again, he's still skinny. So it gives you the idea of where he started.
He's very happy with his abs. Yeah, that's something. Yeah, he wouldn't imagine he would get abs. Yeah, grow abs.
Well, so there you go. For people at home, if your kid's a little like sullen, not whistling, not being happy, and he doesn't have a 6-pack, then maybe this program can help with that.
Yeah.
So we've gone through this. I think right now you guys have said that he's somewhere around like 95% better, and is that right? What's that other 5% look like to you? And I have a few follow-up questions for that too. What?
I would say from my end, and I don't know if this is actually correct or not, but we can't hide it. When we see Khaled, and especially when we compare Khaled with his peers at school, and we would love for him, just to gain few more kgs, perhaps the height. Because for the last 4 years, his growth was actually affected big time.
I mean, makes sense, right? He's basically malnourished. He's limited in what he can eat, and whatever he does eat, he's not getting the nutrients from it.
Exactly.
Yeah, but I'm not too concerned. I'm not too concerned because we are in a completely different place today to where we were like 5 or 6 months ago.
Well, and that was actually one of my questions. How, at the beginning, you said that it was kind of unbelievable. And again, you're rightfully so, right? You should be skeptical. At this point, are you fearful it's going to come back? Are you fearful that maybe he was just in remission and this is just a coincidence?
I don't think so, because we were literally just on the edge of changing medication. We'd had no other option but to, because the doctors were talking to us seriously, we need to think about changing Khaled's medication. And that was the only option we had. And the only variable we did in Khaled's life is Dr. Caleb and the spine and the exercises.
And we made sure we didn't introduce any new supplement, any new regime, any new food, any new routine, just the exercise, the spine exercise, just to see because if you introduce too many things at the same time, Maybe
You-
will
you don't
be.
know,
We
yeah.
don't know what was working on, and yeah.
Can I look? The fear is always going to be there
Yeah.
because we're traumatized big time. We spend 90% of our time for the last 4 years at hospitals, so we're traumatized. But I believe spine played a key role in Khalid's healing.
Yes.
There's no other thing that actually healed Khalid similar to the exercises in the spine.
Well, and we talk a lot about that at the beginning, like minimize variables, because we want to know, if he's having good symptoms, bad symptoms. We want to know it's because of what we're doing. Have you guys started telling anybody else about this? Friends, doctors, anybody? And what response have you gotten?
Well, I told a friend of mine, a colleague at work, because he's probably in his late 40s and he has been struggling with ulcerative colitis for, 10 plus years. He has a lot of faith on the Western and the medicine, but I shared my story. I shared the benefits, and he said, "I'm gonna definitely book a time with you."
Nice. It's probably better than what I get. I get a lot of pushback.
Yeah, the doctors though.
Yeah, there's some, maybe a couple of them, they maybe thought about it, but any of Khal's doctor, when we tell them, and they say, what's going on? What happened? Because they were pushing to give him antibiotics, as Khalid's dad said, changing medication. Even at one stage, we saw colorectal surgeon.
Yeah.
Yeah, and they were, okay, well, try. They were skeptical. They didn't really put us down, but they were, okay, whatever. You want to lose your money, lose it. You want to
Sure.
pay for something, it's up to you. We're not going to interfere. But guess what? We came back to them after a couple months, and everything is great. And asked what was going on, and that was our answer.
No,
It's working out on working his spine.
That's great. It's great that you were able to do that. I've thought that I'm going to get more pushback from the medical system than I am from the general population. So you seeing that is no surprise. But the fact that you still stuck with it and you still tried something, you still looked for something different, because, like what you said, you tried all the medication, you tried all the antibiotics, you were trying everything that was suggested, and it still wasn't working. So starting to look for something different, it just makes sense to me. And that's a message I try to get out there. If you've been doing something for a reasonable enough time, typically 4 to 6 weeks, and you're not seeing a change, it's time to start thinking the treatment, and it might even time to start thinking the diagnosis.
Exactly. Yeah.
But even if, let's say, because we don't know if anything is not normal, Khalid himself now has a high confidence on that there is a way out, and my way out is to do these exercises and push the limits, and just be confident. He's much more confident boy than what he was 6 months or a year ago.
No, that's great, and that's something I look forward to. It's not just treating the underlying problem, but it's empowering you. Now you know what to do. Now maybe he slacks off for a little while, and 2 years from now it starts to come back a little bit. He knows what to do.
Exactly.
Yeah.
Exactly. Yes.
No, that's great.
There's for the 5% for me. I just wanted to add one thing. Why it's 95%? The 5% is we're hoping, though we're not preaching about just ditching the medications, but I'm really hoping to leave the medication out and just let the body heal on its own. That's for 5%. We're aiming for that.
No, I'm excited to see that too, and it makes sense on what you said. He was on the same medication. It wasn't working, so it makes sense. Obviously, that's a talk that you have with your doctor. But I'm excited to see that too.
Yeah.
Yeah, and I have other patients, that have gone off the medication and have talked about this. So for the people out there listening and wondering, that's definitely an option, and it just makes sense. That was his third medication. It wasn't working. It was failing. But yeah.
And before coming to you, by the way, I did my homework, and I came across also one of your patients who, a young gentleman who have been exercising with you for almost 5-6 months, and when you search on YouTube brings all these relevant videos
right.
to you as a recommendation, and he just popped up. I was like, that's it. That's another sign we should go ahead and try.
Well, and now people are going to be watching your video and then doing the same thing. No, it's great. And again, thank you guys. I honestly can't thank you enough for being here and being willing to share this. It's personal information. It's not the same as a shoulder injury or a knee injury. It's a little bit more personal. But being willing to share your experience and the whole history of what you've gone through and how it's worked and how it hasn't, and hopefully there's going to be somebody that comes across your video and because of your video, they find a solution too.
Because knowing the suffering, living the suffering ourselves as a family, and as Khalid, you can't hold back a good information or a good or help that someone else can use it. That's why we were more than happy to share this experience, because maybe even if we helped one person or we came across one person that listened to our experience, that will be amazing.
Oh, it's great.
To everyone in the world, but we are more than happy if we helped even one person.
Really appreciate it. Yeah, no, it's been great working with you guys. I look forward to seeing Khalid over the next few months and just get that 5%, and it's been a pleasure watching him gain energy, gain weight, gain the ability to go out and play, and
you've seen that change with your own eyes. I mean, just through the screen, but you saw it.
Yeah, no, and that's another thing. This has all been over telehealth, which telehealth can be very effective, but in person's always best. But the fact that we're able to do this across continents is amazing.
True.
Yep. A foam mat and weight.
Yeah, and with little equipment too, right? Can't make it any simpler. Well, thank you guys. I really appreciate your time, being willing to share. We'll talk soon. But again, thank you for putting this information out there.
Thank you so much.
Thank you.
Appreciate it.
All right, have a good one, guys.